Vaginal hygiene products such as tampons, period underwear, pads, and menstrual cups are used to absorb tissue and blood during your period. There's no right product to use. It's all about what makes you most comfortable. The main purpose of these products is to keep blood and tissue off your clothing and also make sure you can go about your day as normal. All of these methods come in different sizes so they can accommodate both light and heavy flow days. Pads are made of absorbent material and placed in a person's underwear while they're experiencing period bleeding. Before you use a pad, make sure to wash your hands. Have the underwear that you would like to place the pad in ready. You can have it pulled down, or you can get the underwear prepared before putting them on. Next, remove the backing from the pad. This is typically plastic or paper, but sometimes the wrapper also works as the backing. Place the sticky side of the pad to the portion of your underwear that goes between the legs. Some pads have wings on the sides so that you can secure them to the underwear to prevent leaks and stains on your underwear and clothing. When your pad has become soaked, you can remove it from your underwear and throw it in the trash and replace it with the new pad if you're still on your period. Some people choose to roll it up and place it in the wrapper from the new pad before placing it in the trash. Just like tampons or condoms, you should never flush these down the toilet. Tampons are made of material that absorbs the blood and tissue from a period inside the vagina. Tampons can come inside an applicator, which assists with getting the tampon into the vagina, or without an applicator, which requires someone to use their finger to insert the tampon into the vagina. Tampons should be taken out or changed every 4 to 8 hours, but you can do it more frequently if you wish. To insert a tampon, you first want to wash your hands. Then sit on the toilet or stand. It may be more comfortable to place one leg up on the toilet or bathtub while standing, and do your best to relax. Insert the tampon into the vagina. Sometimes it's easiest to hold the labia open with one hand and insert the tampon with the other, angling it towards your back. If the tampon has an applicator, insert the applicator into the vagina and push the plunger to fully insert the tampon. Then pull the applicator out. If the tampon does not have an applicator, push the tampon to the back of the vagina with one finger. The tampon should be fully in the vagina and the string should be the only thing coming out of the vagina. To remove the tampon, wash your hands and sit on the toilet or stand. It may be more comfortable to place one leg up on the bathtub or toilet while standing. And then pull on the strings of the tampon. Throw tampons away in the trash. Never flush them. Here are some important things to know about tampons. If you notice that blood is leaking while you have a tampon in, try changing it more frequently or using a larger sized tampon. Only use tampons when you are on your period. They are not meant to be used for things like vaginal discharge. Do not use tampons that are scented. The chemicals used to make tampons scented can cause issues like bacterial vaginosis and yeast infections. If you have discomfort after inserting a tampon, it is likely that it is not inserted far enough into the vagina. It is okay to use a tampon even if you've never had anything else inside the vagina. Tampons cannot get lost. There's only one way out of the vagina, and it is through the vaginal opening. If you are having trouble removing a tampon, call your medical provider. Menstrual cups are small and flexible reusable cups that are made of rubber and silicone. They're used during the period to collect blood and tissue inside the vagina. They should be taken out and emptied every 8 hours, but you can do this more frequently if you wish. To insert a menstrual cup, you first want to wash your hands. Sit on the toilet or stand. It may be more comfortable to place one leg up on the toilet or bathtub while standing, and do your best to relax. Fold the menstrual cup to make the top of the cup as small as possible. You can fold it into a C, also known as the C fold, or you can use the punch down fold. Next, it is time to insert the cup. Gently hold your outer labia apart with your non-dominant hand, and then use your other hand to slide the folded cup into the vaginal opening with it tilted towards your tailbone. If you are having trouble inserting the cup, you can always apply water-based lube on the top rim of the cup to help. As you slide the cup into the vagina, release the fold. The entire cup, including the stem, should be in your vagina. To remove the cup, first wash your hands. Sit on the toilet or stand. It may be more comfortable to place one leg up on the toilet or bathtub while standing, and do your best to relax. With one hand, gently separate the labia and insert 2 fingers with your other hand into the vagina. Pinch the cup slightly above the stem to break the seal. Next, gently and slowly wiggle the cup down out through the vaginal opening. Empty the cup into the toilet. Rinse it in the sink with cold water and dry it with clean toilet paper. If you wish to wash your cup, use warm water with mild unscented soap. Then you can either reinsert the cup or put it away until your next period. These are some important things to know about using a menstrual cup. If you have an IUD and would like to use a menstrual cup, make sure to break the seal completely before removing the menstrual cup. If the seal is not broken, it can pull your IUD down into your cervix. If you are having breakthrough bleeding, check the holes at the top of the cup to make sure they are not clogged, because this helps create the seal of the cup. If you are having discomfort after inserting the menstrual cup, it is likely that it is not inserted far enough into the vagina. It is okay to use a menstrual cup even if you've never had anything inside the vagina. If you have any questions about any of these period products, text us at 720-593-9880. If you're having trouble finding or affording period products, visit redequity.org.